I'm going to rush through the risk factors, a little bit about how to screen, diagnose, and a little bit about the treatment of breast cancer. So this is the normal breast. This is a cross-section of this duct here, showing the normal cells that are sitting in a neat, regular, proper fashion. This is stage 0 breast cancer, where that same duct that we saw earlier has these cells that are actively proliferating, growing without any reason, and hence it is called stage 0. That means the bad cells have not escaped outside this duct. Some quick stats on breast cancer. So female breast cancer is the second leading cause of cancer death in women, and it is exceeded only by lung cancer. And presently, there are 2.6 million breast cancer survivors in the United States, and I'm proud to say that. Things we can do to help reduce our risk for breast cancer. It has been shown that those who have their first child before age 30 have a slightly decreased risk for breast cancer. Oral contraceptive pills do put women at a slightly higher risk for breast cancer, especially when they've used it within the last 10 years. Being overweight or obese does increase the risk for breast cancer, and it is recommended that women do exercise. Walking as little as 1.25 to 2.5 hours a week reduces the risk by about 18%. Being aware of the signs and symptoms of breast cancer, which could be a new lump or mass, swelling of all or part of the breast, skin irritation or dimpling, breast or nipple pain, nipple retraction, where the one nipple looks like it's been pulled in or looks a different way. What can we do to detect breast cancer early? Things that we regularly recommend are a screening mammogram, a clinical breast exam, which is a breast exam done by a physician in the office, usually recommended for women in their 20s to 30s when we don't generally do mammograms, recommended every 3 years and after age 40 annually. So a mammogram. The advantage of mammogram is that we try to pick it up at an early stage so that the women will need less treatment, less chemotherapy, less radiation maybe, and also help with decreasing the chance of death. This is what the breast looks like under a mammogram. So the callback. Every woman is scared of this. Just to reassure that less than 10% of the women who are called back for these tests are really found to have breast cancer, and only 2 to 4 mammograms of every 1,000 lead to a diagnosis of breast cancer. Once breast cancer is found, the things that we do to further clarify is after the mammogram, sometimes we look at an ultrasound, get an MRI of the breast. Then we also need tissue, so we use a fine needle. Either the surgeon uses a fine needle, and then sometimes it's a core needle biopsy. Treatment of breast cancer, that depends on the stage. The earlier the stage, the less the treatment, and that is what all oncologists hope for, that we try to find the cancer at a very early stage so that we don't have to submit the person to unnecessary chemotherapy, radiation, or other medicines. The goal is, we know that surgery alone can cure a significant number of women, especially if it's early stage, then surgery alone can cure quite a good number of cancers. But some women do relapse, and the trick is in trying to decide who might have a higher risk of relapse so that we can give them the therapy that they need to decrease the risk.